Okay, I think I left off with rectocele, which is a herniation of the anterior rectal wall through the relaxed or ruptured vaginal fascia and rectovaginal septum. The rectocele is small and produces few symptoms. Hold on, get this thing going again. And symptoms absent when lying down. Causes disturbance in the bowel function, sensation of bearing down, or sensation that the pelvic organs are falling out. Thromboembolism. SVT pain and tenderness in the lower extremities. Physical exam, warmth, redness, and enlarged hardened vein over the site. DVT, unilateral leg pain, calf tenderness and swelling. Physical symptoms, redness, warmth, plus the Homans, and other signs and symptoms are apprehension, cough, tachycardia, hemoptysis, increased temperature, and pleuric chest pain. Pulmonary embolism is characterized by dyspnea and tachypnea. PPD with psychotic features. Postpartum psychosis syndrome characterized by depression, delusions, and thoughts of harming the infant or herself. Psychiatric emergency may require psych hospitalization. Antipsychotics and mood stabilizers such as lithium are the treatment of choice. Loss and grief, uncontrolled, cry, very solemn immediately after the event. Family aspect, help actualize the loss. I'm sorry, that cut and dry. Chapter 39. This is, well, where'd all this come from? I don't know. Oh, well. Chapter 39, Turner syndrome. Turner syndrome affects females. It's an absence of the X chromosomes missing from all cells. Generally causes infertility. Absence of the X chromosomes missing from all cells. That's Turner syndrome. Generally causes infertility. It's evidenced at birth by a webbed neck, low posterior hairline, widely placed nipples, edema of the hands and feet. Evidenced at puberty. By puberty, they're going to be short in stature, sexual infantilism, amenorrhea. It's confirmed by a negative sex chromatin test. The treatment for Turner syndrome is growth hormone, estrogen therapy, psychological counseling. We're going to have difficulty with peer relationships, behavior problems, and difficulty understanding social clues. Nursing care management. Assist with support for the patient and family, explaining tests and therapies. Klinefelter's syndrome. That was Turner syndrome. Klinefelter's syndrome. It affects males. They have one or more additional X chromosomes. Rarely it's not diagnosed prior to puberty, and most often not until the male is screened for infertility. The test is chromosomes analysis. It's evidenced by small testes, cognitive impairment, gross motor skill difficulties, developmental language delay. This is Klinefelter syndrome. Poor verbal skills, reduced auditory memory, shyness and passivity, behavioral problems and school difficulties, Klinefelter syndrome. Nursing care management assists with support for patient and family, explaining the tests and therapies. ADHD, the symptoms must be present before age 7. The testing, it's an IQ, eye-hand coordination, measurement of auditory and visual perception, comprehension and memory. Often there is a wide gap between IQ scores and verbal performance. Treatment and medications, the most common are Ritalin and Dexedrine. Environmental manipulation, decrease their external stimuli, reduce their distractions, consistency in their routines, provide a stable and predictable environment. Classroom education, have an individual education plan for these folks. Nursing care management, assist with support for the patient and family, explaining tests and therapies. Knowledgeable about the medications prescribed, when they should be given, evaluate the effectiveness of therapy, education for patient, family members, and the school teachers. Moving right along. Couple more pages. 2, I guess. Enuresis, bedwetting. After age 5, more common in boys, normally will cease between the ages of 5 and 8. Some of the treatments for bedwetting is tricyclic antidepressants, antidiuretics, antispasmodics, oxybutynin, desmoressin nasal spray. Desmoressin nasal spray is the most common medication. Enuresis, desmoressin nasal spray is the most common medication. And tofranil. Therapies, you want to restrict their fluid after the evening meal, bladder training, interruption, their sleep devoid, and bed alarms that detect wetness. Assist these patients with support for the patient and family, explaining the tests and therapies. School phobia. Extreme reluctance to attend school for a sustained period as a result of severe anxiety or fear of school-related experiences. Physical signs and symptoms of school phobia: nausea, vomiting, diarrhea, headache, dizziness, leg pain, abdominal pain, even a low-grade fever. Signs and symptoms do not present on weekends or holidays. Nursing care management, encourage the parents to get the child back into school. Help explore that root cause of the phobia. Maturation of systems, the GI system. Less upset stomachs, better maintenance of BG levels, whatever that is. Caloric needs are less than as a preschooler. Bladder is generally larger in boys than in girls than in boys. Cardiac. The heart growth is more slowly, and the heart is the smallest. It will be compared to the rest of the body during this time. The heart is the smallest it will be compared to the rest of the body during this time. Heart rate and respiration decreases and the blood pressure increases. The immune system, increase infections the first and second years of school due to increased exposure to pathogens. Immune system's getting stronger and better able to adapt. Skeletal system, the bones continue to ossify and lengthen. Parents need to be aware that children should not carry heavy loads due to immature adaptability for bones to respond to pressure and muscle pulling. The GI system, let's go back to that again. Less upset stomachs, better maintenance of BG levels. Caloric needs are less than a preschooler. Bladder is generally larger in girls than in boys. The heart is growth is slow, so the heart is the smallest it will be compared to the rest of the body during this time. Prepubescence is a period approximately 2 years to the onset of puberty. This is a period of considerable overlapping of developmental characteristics. Social development, peer group identification, and gaining independence from parents. It is important for parents to provide safe boundaries. Valuable lessons are learned by daily interactions with age mates. Children become increasingly sensitive to the social norms and pressures of peer group. The interaction among peers leads to the formation of intimate friendships between same-sex peers. Social clubs and peer groups become important to join and have a sense of belonging. Peer group bonds can become too strong and have a negative effect on the individual. The relationship with families. Parents are the primary influence on the child. Children need their parents to be parents and not the child's buddy. Coping with concerns related to normal growth and development. Latchkey children. Elementary age children who are left to care for themselves before or after school. Inadequate adult supervision leaves them at high risk for injury and delinquent behavior. Children may feel more isolated and lonely than non-latchkey children. To compensate, they may have the TV volume up loud and use pets for comfort. Stress and fear can cause chronic illness. Children should be taught to recognize the signs and symptoms of stress and how to learn techniques on dealing with stress. Signs and symptoms: a child is in stress. stomach pains or headaches, change in sleeping pattern or nightmares, bedwetting, changes in eating habits, aggressive or stubborn behavior, withdrawal or reluctance to participate, regression to earlier behavior such as thumb sucking, trouble concentrating or changes in academic performance. Sexual education. Children may engage in sexual play prior to pre-adolescence. This is normal. Children are very curious about sex and will ask questions about it. It is best not to give them misleading information, but information that is appropriate for their age. The nurse's role is to answer the child's question honestly in terms that he or she can understand. Encourage to talk about the body parts without the use of nicknames, but rather proper anatomically correct names. Chapter 40, Sexual Maturation, Boys and Girls. Enlargement of the, this is for puberty, I'm going to assume. For boys, enlargement of the testicles, growth of pubic hair, body hair, facial hair, appears 2 years after the pubic hair. Rapid increase in height, changes in the larynx, nocturnal emissions, and abrupt deceleration of linear growth. For girls, breast buds is the first sign, rapid increase of weight and height, growth of pubic hair, appearance of axillary hair. Menstruation starts within 2 years of first signs, abrupt deceleration of linear growth. Psychosocial development, according to Erickson, developing a sense of identity. During the early stages of adolescence, pressure to belong to a group is intensified, gives a sense of status and belonging. The individual ID is an ongoing process. It is time-consuming and in periods of depression, confusion, and discouragement. Sex role ID, peer groups play a role in what is expected as well as adults. Emotionally, they will vacillate in their emotional states between considerable maturity and childlike behavior. They are better able to control their emotions later in teenhood. Social development, Chapter 40, relationships with their parents. The relationship changes from protection dependency to one of mutual affection and equality. Relationships with peers becomes more important to them. Sense of belonging and helps with the transition from dependence to autonomy. And that is it. Good luck, and you will do well.